So when someone's getting lower back pain down through here that goes off to the side, very often it's not actually coming from the back itself. It's not coming from the spine or the discs, and also it's not coming from the muscles either side, and it's definitely not coming from tendons or ligaments. It's not that. What often is the case is it's coming from what we call the glute medius muscle, which is a muscle either side down through here that's underneath the gluteus maximus muscle. So this is Amber, my wife, she's going to be helping us with all the exercises today, so let's get started. So the glute medius muscle runs along the top of the iliac crest here, down through and attaches to the outside of the hip bone, which is the greater trochanter, and it's underneath the bigger gluteus maximus muscle, right in that spot there. The big function of the glute medius muscle is to stabilize the lower back and the pelvis area. So if you lift your right leg up, you can see that on one leg, the pelvis wants to drop down like this, but the muscle here is contracting, the glute medius is contracting and keeping the pelvis level. Now that's obviously really important for the lower back because the lower back sits on top of the pelvis, and if there's instability here, there's instability in the lower back. So to test that function of this muscle, to see how it's affected on you, what you can do is what we call the Trendelenburg gait. So if you're standing in front of a mirror and you lift one leg up, as you remember, I say the glute medius muscle contracts to stop the pelvis from dropping down. If you lift one leg up like this and you find that your pelvis is level and it's easy to do, that's good. Lift the other leg, it should be even again and easy to do. If you're lifting your leg up and you're finding that you're having to hitch your hip slightly, it shows this muscle's weak, and rather than just holding level, it's overcompensating and it lifts and hitches that hip up. So two further tests that we can do is simply walking like this. And when you're walking, do you feel even both sides? When you take a step, do you feel any pain grabbing hold on each step that you do? And then to test it further, another one you can do is standing on one leg and making sure you can hold yourself there with a level pelvis for about 30 seconds to a minute. And if you can do that on both legs, the function isn't too bad. So you've tested the function of the muscle. Now we're going to see how painful it is. So if you're pressing with your thumb in around this area, all through there, you press in and it should just feel like a spongy muscle. If you press and you can feel pain, that's a good indication that there's some sort of dysfunction and tightness in this glute medius muscle. And what we've got to do, if that's the case, is we've got to address it, because that's always going to be a problem. It's always going to create instability through the pelvis. And of course, it's going to create that pain that radiates all through this area. So the exercise we're going to do is this. I want you to lift your leg up, but turn your foot internal and bring it back slightly to there. So from here, you're going to get your thumb and you're going to push into the side here where you're feeling a little bit of tenderness. So you press in, it's a little bit tender through there, and you lift your leg as high as you can and then all the way down. Keeping that pressure into that muscle whilst the leg's being lifted up as high as you can and down. So the muscle, as you can see, its job is to contract through here, which lifts the leg up. A slight internal rotation will actually activate the muscle further, and then we're getting that full range of motion. You'll struggle with this one. It's going to feel quite difficult, and that thumb pressing in there actually triggers the muscle and gets you to work that muscle through the pressure. It's almost like it's flossing underneath the muscle, which will increase blood flow further. So another way that we can strengthen that glute medius muscle is with a standing exercise. So we're going to stand just like this, both feet flat, holding onto something only for balance. And remember, the glute medius muscle through here is what's going to contract to pull that direction there. So what we're going to do, lift the knee up and then lift this pelvis on this side up. You can see there, and lower down, all the way down, all the way down, and then up again, all the way up and all the way down. This is a full range of motion contraction for that glute medius muscle. Even though it doesn't look a lot, it's only a small range of motion that it's going to be able to achieve. So this full range of motion through there, again, relax. And that is working deep into that glute medius muscle, which is a neglected muscle. It's a muscle we do need to contract hard and get some good fatigue going through there. We're now going to move on to an exercise that we can get deep into that glute medius muscle with deep inhibition, or what we call ischemic compression. And we're going to use a tennis ball or cricket ball, any sort of ball that's relatively soft and stable enough to apply some pressure into it without it collapsing. So as you remember, the glute medius muscle comes from the greater trochanter, the hip bone there, up to the pelvis. It's down through here. We need to get the ball into that area and apply pressure into it. And to do that, we use a wall. So you place the ball against the wall and then go against it and just push your body weight into it. Move yourself around until you find a painful spot in that glute medius muscle. When you find it, get pressure into the area. You will feel pain right on that spot. It's going to be painful because this is a tight muscle. You hold it there very still until you feel that pain releasing off and moving down. And then you move again, move around till you find the hot spot. You get pressure into it again. Keep that pressure there. The muscle then releases off, and that needs to be done maybe 4 to 5 times all through this area. The exercise we've just run through is to get some deep ischemic compression or inhibition through that muscle, which then releases the tightness. Now we're going to move on to a stretch. Now it's a difficult muscle to stretch. There's not many ways, but this is a really effective way to do it. So stand about a foot away from the wall and place the painful side with the leg behind and this way. And then you're going to lean your body into the wall. And as you do that, push your hips this way here. You can see that I'm creating a stretch through there, and you use the wall to push your hips in like this, and you'll start to feel a stretch into that glute medius muscle. Now we've strengthened the muscle, we've released the muscle. A really important step is integrating it into a functional movement, a bigger movement where we're activating all the quads, hamstrings, glutes, glute minimus, and of course that glute medius. Now when we're doing this walking lunge, we definitely need to make sure that your pelvis is not doing that and hitching as you're moving. You want to keep your pelvis totally level and through to there. So we're going to do that now. So take a step forward and try that. So all the way down and then back up again. The front foot is staying flat, back knee goes all the way down, the weight stays over the front leg as we go. A really common area where we know someone's not got the strength to do this movement well is when they lunge all the way down and then to come up again, rather than standing straight up, you'll find that you hitch through there and do that. So it's almost like we're avoiding the muscles working and we're getting up by going around the problem as opposed to working through it. So rather than coming straight up, what they're going to do is they're going to go to there, and it's like a hitch through to try and get themselves up because they're not able to activate the muscles effectively. So make sure when you're doing this lunge, you're robotically coming down and then straight up through, down again, and then straight up through like this. And then again, if you're painful in the back specifically, right in the area there, not off to the side, and it's painful when you're bending, it's painful when you're lying on your back doing a little sit-up to get out of bed, for example, then you could have some sort of deep disc prolapse or disc bulge, which could be putting pressure through the area. That's going to be very painful. And if you've got no pain out to the side, but just in the area, then as I say, that disc prolapse will take a different group of exercises. And in that case, again, go and watch my other videos. There's plenty of videos there for back pain, specifically right in the middle. So like and subscribe. And of course, if you've got any questions, pop them in the comment section and we'll be there to help you.